moving on to Dr. Prakhyat Roop's talk, Prudence in Protecting IPA.
Morning to one and all. I'll be speaking about the prudence in protecting our intellectual property. So basically, the question after you have realized your idea and you are innovating on that idea is whether you should go for patenting it or you should keep it without a patent, keep it like an open source. So basically, I don't have any financial disclosures for this presentation. I have divided my talk into two aspects. First is to realize the worth and value of your own idea, and then you have to analyze whether is it worth patenting or not. So the worth of your idea, the protection of your idea, the value of your idea is to be decided first. Now, the worth of your idea is basically depending on the need that it is addressing. What is the felt need in the society among the practitioners, among the patients for that problem? So, if it is a realized problem that clinicians are facing, the patients are facing a challenge and you are solving it, it's important. You have to see how relevant it is in the clinical practice. What is its impact on the patient's lives, and how essential is a solution to this problem, how unique is a solution to this problem. You also have to look at what is the saleability quotient, that is, what is the magnitude of this problem. Is it easy to administer or use this product or this invention? So will it be uptaken fast? What value does it add to the current practice? Does it disruptively change the practice pattern, and is that disruption going to be easy for the practitioners to uptake, or is going to add another challenge and make them stay away from changing their practice? Again, the uniqueness or monopoly is a very important factor in determining the value of the idea. So patentability in essence is a statutory requirement wherein basically what you're saying is your idea is novel, it's new, it's non-obvious, meaning that it is not something that is 2 plus 2 becomes 4. You have to have some inventive step that is completely unique. It's not a coming together of various existing ideas. That is obviously the inventive step in your innovation. There are non-disclosure agreements which can basically help you in liaising with other partners or your collaborators without having to go through the whole process or exercise of patenting. But practically, if you are engaging with somebody, even with a non-disclosure agreement, it's not as good a protection. It's practically futile if the intent of the collaborator is not nice. One has to look at the various stages of filing a patent, and they have different expenditures. So you can file a patent in India, and then you can file a PCT application that provides you a 3-year bracket where you can decide which individual territories you would like to patent your product in. And these have increasing costs. India patent will cost around maybe 30-40,000 rupees, and a PCT application may be costing around 1.5 lakh, and then individual territories would be much costlier. So one has to consider the cost while going ahead and planning at what stage they are going to do which process. We have to explore the scope of patent with respect to its maintainability and its cost effectiveness. Maintainability meaning how much can somebody work around this patent to get a new product that is not covered by your IP, and that becomes a challenge. To drive this point home, I am going to use a simple example. So to determine the value, first you decide what is the quantum of need. That is it a single use product or is it a reusable product? A reusable product is less likely to be giving you enough value in the long term if you patent it, because somebody who is going to reuse it is going to buy it once. The cost of IPR actually adds into the cost of product. So one has to decide if that is a viable thing to do. One has to look at the existing competition. So basically, again, the option of what are the alternatives, how novel or how disruptive is the idea, and is it going to drastically change the practice and be uptaken very fast. And lastly, the possibility of bypassing it. So I will take the example of two instruments or two devices that I designed. One is the ND ring, which is an implantable device, a secondary implant that goes in the sulcus to treat negative dysphotopsia. The other one is a chopper, which I designed for my own phacosurgeries. So if we look at the ND ring, the main value of the product lies in the idea. It lies in the design of the invention. The manufacturing cost itself is quite low. If we look at one piece of the product, the cost of making it is very, very cheap. The marketing cost is high, and it is a single-use product. That is, once it's implanted in the eye, it's gone, so one has to buy a new one. We look at the chopper, the value does lie in the idea, but the inventive step is not that great a thing that it's a small incremental change. The manufacturing cost is significant. If we look at the instruments that we buy, the raw material and the machining of it is actually quite costly, and there are not that much margins. The marketing cost is low. You will rarely find somebody advertising a chopper. You will only find it at the stall. It is a reusable product, and once you buy it, it's going to continue with you for years. So if we look at the ND ring, we had to first understand the etiology, make a 3D model on the Zmax ray tracing software. Then we designed a secondary implant that simulations and everything would go on. And eventually we find the right prototype, manufacture the prototype, test it, do a clinical trial, and then it becomes a product that is worth using in the eye. If you look at the chopper, I send this drawing to the manufacturer, or if I would know how to 3D print and John would help me, I would 3D print it. And then I would see it, use it, and if there are some changes, I would get it done, and that's the end of it. So the only change that I did in the chopper design is adding this bend, which changes the vector forces during the chopping and makes my life much, much easier. So if you look at the process, designing the ND ring and getting a usable prototype in itself is a very complex process. It involves a lot of interaction with heavy machinery, industry, implantable devices, regulations, things like that. And the idea is difficult to circumvent. You cannot, you will not get a very quick idea or a very small workaround around this idea and bypass the intellectual property. But if you look at the chopper, the design is easily modifiable. I have added one bend. Somebody might say that, you know, this works better, and add another bend to it or do something else to it and make a new product. So basically, to maintain the patent of the chopper is difficult. First of all, it will be difficult to convince that this is a novelty. And secondly, even if you get the patent, it is difficult to maintain it because somebody else will change some things and bring out a new chopper. So in the ND ring, like I said, the cost mainly lies in the R&D, and the selling price can be dictated because it is a unique product that addresses a very big problem. When you have a patient of negative dysphotopsia that is sitting in your clinic and you are afraid of doing an explant or an exchange of IOL, you have this option of just going in and putting this sulcus implant in a pseudophakic patient. You know that you are going to go for it. It's not the cost that is going to matter to you. While if you look at the chopper, suppose I patent it and the patenting itself costs me 10 lakh rupees for the major territories, that costs add to the product. And so when you go to buy your chopper, that chopper is going to be much costlier than its competition. and it is a price sensitive product. So it will remain unpopular if it is that costly. So the choice that one has to make is between patenting or not patenting it but popularizing it. So the advantage that you get with patenting is that you get the credit, the name stays with you, you get your due recognition for giving that novelty, giving that inventive step to the practice of ophthalmology. The other advantage is that you can easily go in for collaborations with other people, and that you don't have to worry about the credit going away from you. The third is obviously the monetization aspect. You are able to monetize it, get your royalty or whatever, get your due for that idea. The disadvantage definitely is that it increases the cost of the final product, and it, because the costs get higher, the popularity of that product may remain less. Thanks a lot. I would request everyone to please scan this QR code and download the AIOS app. And if you find this IC useful, please rate us on this app. Thanks a lot.
Thank you, sir. Thank you for that wonderful talk. And I think him having two products, one patented, one non-patented, gave us quite a good idea of what we should patent and what we should not. So